Welcome everyone to today's webinar, Solving Patient Experience Challenges Through a Strong Digital Front Door. I'm Erica Carbajal, and on behalf of Becker's Healthcare, thanks so much for joining us today. So before we begin, I'm going to walk through just a few quick housekeeping notes here. So first, we are starting today's webinar with a presentation, and there will be time at the end of the hour for a question and answer session. You can go ahead and submit any questions that you have throughout the webinar by typing them into the Q&A box that you should see on your screen. Today's session is also being recorded, so it will be available after the event. You can go ahead and use that same link that you used to log into today's webinar to access that recording once it's available. And if at any time you don't see your slides moving or if you have trouble with your audio, just try refreshing your web browser, and you can also go ahead and use that same Q&A box for any technical questions that you might have. We're here to help with those. And with that, I'm pleased to turn the floor over to Mike Pedig, Vice President of Healthcare Experience at Avtex.
Thank you, Erica, for that wonderful introduction. We're excited to present today's topic on digital front door and how you can use it to solve some of the more pressing patient opportunities. I'll use the word opportunities instead of challenges. Today, we will spend some time meeting the presenters and hearing stories. We've got some industry trends that are driving the change. We certainly need to cover what is a digital front door and why do you need that strategy. And then we've got two wonderful partners from Advocate Aurora Health and Dispatch Health that will share their journey to creating a digital front door. Some of the best practices, tips and tricks, and maybe even a few things that they wish they did differently. We've also got one of our colleagues, Matt Malashevsky, who will share a similar experience based from our own Avtex portfolio of clients. And then, as Erica said, we will finish with a Q&A. So again, I encourage you to submit those questions. We'll be monitoring those all along and address as many of those as possible at the end. But let's start first with our wonderful list of presenters. And Jamie, could we go to you first?
Yeah, absolutely. Thank you for having me, and thank you to everyone for taking time out of their day to join us. I'm the Assistant VP for Consumer Experience at Advocate Aurora Health. We're responsible for creating a seamless and connected end-to-end experience for all of our consumers and patients. That involves user experience design, digital technologies, the front door, which we're going to talk about here in a little bit. So thanks for having me today.
Thank you, Jamie. Chad?
Thanks, Mike. I'm Chad Thorpe, and I work with Dispatch Health. I support our care team, which is really the first entry into the organization to get seen. So our onboarding and customer service teams. Thanks for having me.
Thank you, Chad. And Matt?
Yeah, hi everybody. My name's Matt Malashevsky. I work with Mike Pedig over here at Avtex and leading the healthcare practice and really engage our clients on helping define and develop digital front door strategies.
Excellent. Thank you to all the presenters. At Avtex, we focus on the customer experience, and it's really in our DNA. And it's why we were excited to partner with Becker's today to present this webinar. As you can see, customer experience is in our vision and mission, really. We talk about every day how we can help our own clients deliver exceptional experiences to their consumers. And throughout today's presentation, we will talk about consumers, patients, members. We will use those terms interchangeably, but ultimately it's about delivering those wow moments. And what we found is really a four-staged methodology that's proven to be successful. In every engagement, we start with the CX design, helping our healthcare clients either create or refine or update their customer or consumer experience strategy. Once you understand what that plan is and how to execute it, and you have organizational alignment, then we also have the ability to pull in a number of technology solutions to solve those most pressing problems in your organization, whether it would be the need for a patient or member 360 and solving that through a CRM solution, the ability to take your data and add insights and make it actionable, leveraging artificial intelligence tools that can drive operational and clinical insights, or deploying an omni-channel approach and strategy and series of solutions to your contact center. And finally, we pull it all together with our in-house development and IP team that can create a custom solution to solve almost any challenge. What we've found is that our clients who consistently prioritize the consumer and customer experience see improved outcomes, both financial and clinical, and maintain a competitive advantage. We'll spend a little bit more time on some of the Avtex tools and tool sets. And in fact, at the end of this presentation, we've got some links to share with you that I think will certainly accelerate your path towards a digital front door. This is why we're here today. Healthcare is evolving and evolving quickly, and no doubt the pandemic has accelerated that. And what it's also done is increased the expectations from our consumers. In the past, if I was checking into a clinic, I used to compare that experience to a previous clinic or hospital check-in process or registration process. But now what I'm doing is I'm breaking down those silos, and I'm comparing it with experiences I've had in other industries. If I'm scheduling an appointment, I'm comparing that with how easy was it to make a reservation for a restaurant through OpenTable. If I'm checking in to a clinic, how does that compare with checking into my hotel room at a Marriott? This is what we in healthcare are competing against. And at Avtex, we say the last best experience of your consumer is really who your competition is. And so if you're not today, it's time to focus on the experience. With 81% of consumers saying they're unsatisfied with their healthcare experience, there's a tremendous gap to fill. Now, the good news is we've brought a panel together that they are going to share a number of ideas and suggestions to help us close this gap. But it's important to focus on the experience, and we're going to reinforce that throughout today's presentation. Each year, just to drive this point home a little bit further, we conduct an annual survey of over 1,000 patients nationwide. And they're telling us what's going on in their minds, what are they worried about, and what would they like to see improved. And from our own surveys, we found that 71% of patients said, I want my healthcare experience to be more like other areas of my life, including online shopping. We've all heard them describe, I want this Amazon-like experience. That means self-service. That means ease of use. That means feeling like you know me, you value me, and you can help me. It's personalized and on any device when I want it. 69% said they're hoping healthcare providers can improve how they interact with patients. Multiple channels, whether it's text, mobile, portals, or other apps. Payers have the same opportunity to improve because 41% of those surveyed said it's difficult for me to get the information from my health insurance plan, and 33% said the same thing from my provider, from their providers, which is why we're here and where a digital front door can certainly help close that gap and solve this. But we should probably start with what is a digital front door. In our view, it's all of those digital touch points where a healthcare organization interacts with their consumer. Here's 4 criteria that you should think about when defining your digital front door. Number 1 is it's a modern approach to that patient interaction. You're not relying on billboards or TV or print or radio to communicate with them because that's not personalized. This offers individuals the ability to access their care when and how they want it on their device of choice. It is a strategy. A digital front door is not an individual technology solution. It's more than a mobile app. It's a strategy for all of those. It's an ecosystem that works together and it's consistent for every touch point. Whether I start my journey with searching for information on Advocate Aurora's website, or whether I'm paying for my care after a visit with Dispatch Health, it's at every point along that journey. And it's digitally optimized so that those patients can find the information that they're looking for easily and quickly, and they can get the support that they need. And finally, it's integrated. No more data silos. Patients now expect us to have access to all of the information in all of our systems to deliver that personalized experience. In fact, they're also expecting us to look for data from third-party sources that we may not capture today. And you may hear us refer to social determinants of health as one example. This is important. A recent report from IDC said that by 2023, which is not far away, over 65% of your patients will be accessing their care through a digital front door. And we've got our first poll for today. So I encourage all of you to take just about 30 seconds. Question is, does your organization currently have a digital front door strategy? Either yes, no, you're working on it, or it's on the future roadmap. All right, I'm starting to see a few results come in. We'll just give it about 10 more seconds. Excellent, and thank you to all of you who submitted. This is pretty consistent with what we've found before, and certainly we've experienced from Avtex. Many of you, about a fourth of you, currently have a strategy. There's a number of you who recognize that this is an area where we'll need to focus going forward. And the good news is that almost half are currently working on a strategy, and another 17% at least acknowledge that you need one and it's on your roadmap. Now is the perfect time to transition to our first presenter. And with that, I'll hand it over to Jamie from Advocate Aurora Health. Thank you, Jamie.
Afternoon, everyone. Thank you for the opportunity again to kind of walk through what our digital front door journey has been. Just real quick, the obligatory organizational slide. Advocate Aurora Health is in Illinois and Wisconsin, and has been working to really advance our overall consumer strategy, which is heavily powered by this idea of having a digital front door. And as Mike said, when we were making the case to the organization around bringing these elements together into a cohesive strategy, we really looked at what are the benefits of consumer experience. As Mike said, these expectations are coming into your organizations from retail, from travel, from finance. And we went to Gartner and other organizations and realized that if you're a CX leader, there's a business benefit. Not only is there a consumer benefit, but there's a large business benefit as well to being a leader in this space. So we organized our overall strategy around a couple of key initiatives that are all born out of a singular focus to deliver a seamless, personalized, end-to-end experience for our consumers. So we got the organization rallied around this kind of larger purpose statement. At Advocate Aurora, we help people live well is our purpose statement. How does that turn into a vision from a consumer experience perspective? And we have created a consumer-first executive steering committee that helps govern the projects I'm about to walk you through, helps ensure that connectivity that Mike was talking about to make sure that we're breaking down silos and moving work forward. So for Advocate Aurora, that turned out to be 5 critical initiatives. And I appreciated the definition about digital front door because it's been evolving and emerging. And for a little while, it was all about your mobile app. But it's really about a connected ecosystem of experiences. So digital platforms for us are the websites, which frankly are still our largest digital front door at over 30 million sessions every year across 3 of our large websites. So that's still a critical place for us to engage. We're looking at virtual health. We're improving the scheduling experience. We're looking at how we leverage CRM in our call centers to drive transformation, and then marrying that through the Live Well platform that we're building. So these 5 initiatives, while they're listed as individual initiatives, all converge. I was about to make a Voltron reference for anybody who can throw back that far into the 80s, I think, is when that cartoon was out. Those all come together to make that digital experience, that digital front door, really work for our organization. So I'll walk through these really quick, but did want to set that up from a top-level standpoint. It's a business imperative for us. It's a consumer imperative. We've created some governance and structure around these initiatives so that we can execute at an organizational level. So digital platforms. Advocate Aurora is the result of Advocate Health in Illinois and Aurora Health in Wisconsin coming together. And we've been on a 3-year journey to create a consistent and seamless experience across all of our websites. We don't know who you are necessarily when you're coming to our websites. It's an unauthenticated experience, but we want it to be consistent, we want it to be branded, and we want it to be easy. And we have moved 5 of our flagship sites onto a consistent design system that governs how these sites work. Improved calls to action, lots of flexibility in meeting consumer needs as, again, huge driver of awareness and acquisition for our organization. So these are foundational. I mean, we've all been in the website business for a long time, but you have to remember, again, this is a great way people are finding you. Search optimization, paid search landing pages all really drive people into this experience. Well, we've got you here. Then what do we want to do is we want it to be easy to transact. And I think for most of us, that's scheduling that appointment and really working to streamline that experience. And not just, again, what we're doing from, we're an Epic shop and how do we use open scheduling and direct scheduling, but we want to go a little bit ahead of that. Paid search, organic search, can we push scheduling out into that Google My Business listing? Again, seamless, connected, and making sure that we get you there, we get the appointment scheduled, and then we don't just end there. We don't high five and say we got the conversion and move on. We want to remind you, give you the tools you need to get to the organization. So we think about digital to front desk. That's the second half of this experience with a little bit of an example. And COVID really forced us, as it did for many of you, to adapt and adjust. And how do we leverage those digital properties to, create a more seamless experience, introduce a safe check experience, which allowed you to do pre-check-in online and complete a COVID questionnaire before you got to a facility. So things of that nature, we have this kind of, again, awareness, acquisition, conversion, and then starting to move you in a very seamless way through that process to get you into a clinical setting or a virtual visit, which is another big area for us. I think many organizations went from 0 to 100 on virtual visits. When we set out in 2020, our goal was 25,000 virtual visits for the organization. We did over 1 million visits that year. We went from about 45 providers in an early pilot to over 4,000 providers doing virtual visits by the end of 2020. So COVID, for all of its tragedy and issues, really became a huge accelerator for our organization for a digital perspective. And this is an interesting point from a consumer standpoint. Adoption was always low in virtual visits. Clinicians weren't quite sure about it. Consumers weren't quite sure about it. But when that's your only option to see a provider, it quickly breaks down barriers, right? And providers became more comfortable, consumers became more comfortable, and now it's frankly continues to be a strong channel for us to connect with consumers between visits. Quick care is a huge area for us. So again, all driven out of the health record, integrated clinical experience, integrated into our web and mobile applications to create a very seamless experience, allowing the consumer to choose an in-person or virtual visit, and then executing that virtual visit from those two platforms. So just reiterating Mike's points earlier, these separate initiatives connect from an experience standpoint. The last two that we'll talk about briefly is our transition of our call centers from traditional inbound, outbound call centers to engagement centers and building in access. So if you're having an interaction on our app or in the electronic health record, we're marrying the Epic clinical data with CRM data to create a full 360 view of that consumer, so that if an agent is answering the phone, they're going to know if they've gotten marketing material, they're going to know the last time they were in the app, they're going to be able to personalize that experience, they're going to have guided scripting that will allow them to expand, deliver on what the consumer needs, offer other services, and really connect. Not going to lie, this is a massive undertaking. You can see there, the script's a little busted up, but we have over 70 call centers across our organization, big and small, and doing various things and getting everyone aligned on a consumer-first vision. We're moving their cheese all around to try to improve the experience. It's a big undertaking, but we believe it's core, it's the heart of what that end-to-end consumer experience is going to look like. Consumers expect that you know who they are, you have all this data on them. It's our obligation to deliver that experience against that expectation. And then finally is Live Well, which is today is just our mobile platform, but will become our mobile web and others. It's an expanding area for us. The big driver here that I want to highlight, because what we've done in Live Well is two very important things. The first is we've integrated Epic and free health and wellness tools into a single experience. The second part of that is we give you access to that information either logged in so that you can see that full Epic MyChart experience, or we provide guest access. So you can access the health and wellness tools without having, you don't need to be a patient of ours, frankly. You can access the guided meditations and the meal plans and the other elements that we put in there. So this is where you start to see the convergence of not only the traditional healthcare, sick care organization with the future of health and wellness. We want to be that destination that connects those dots for those consumers, and we're starting to do that through the Live Well platform. So as these things are coming together to kind of deliver on our overarching digital front door strategy, we really realize that it's a house with a lot of doors. We got a front door, we got a side door, there's probably a back door folks are coming in through, kid left the garage door open. So we're looking at that whole scenario and understanding ultimately people are coming at us from different ways, but it's well architected, it's designed. So once they're in the house, they can find what they're looking for and do what they need to do. So last slide here, just some data on that journey that we've been on. We're doing very well in the mobile space as we continue to add feature functionality there. About 2 years to hit that 1 million download area, and we see a steady acceleration there. We're testing mobile adoption versus web adoption and the ability to get to information more quickly. That 70% users prefer Live Well. HRAs, from a conversion standpoint, outperforms any of our other digital properties 3 to 1. So there's a dramatically higher conversion rate of HRAs within the mobile app than there is in other channels. The other big area is this lower right corner here, the 460% increase in engagement. We're seeing repeat usage in the app at a rate we've not seen before when it was just previously MyChart. That free content, healthy recipes, guided meditations, there's an expectation of trust coming from a healthcare provider. We're putting that content out there, validated by our organization, and we're seeing people come back and use that. The recipes are one of the top used areas. Guided meditations are doing very, very well. So we're going to continue to look at how we marry wellness into that space to kind of drive this work forward. So I went through that quickly, but just wanted to kind of illustrate, as Mike was saying, and as Chad's going to pick up here in just a minute, to look at how we have to rise to the challenge that consumers are bringing to the table, and really think like a consumer, acknowledge we're from healthcare, but bring retail, bring other thinking to the table, and demonstrate that we know who we are, we care about you, and we're going to provide you the services that you're looking for. Mike, back to you.
Thank you so much, Jamie. And that leads into our next poll question. Jamie highlighted that a mobile app is just one component of a digital front door and what they're doing at Advocate Aurora. But our question for the audience is, do you currently offer a mobile app to your patients or members? We'll take about 30 seconds to gather answers. Looks like they're coming in, about 10 more seconds. All right, looks like we got a pretty significant number of responses. Do you currently offer a mobile app? Yes, Jamie, they heard you. They understand the importance of a mobile app. And that it is not the only solution, but is certainly in today's world of mobile devices, a key part of a digital front door. About 20% right now currently don't, and I'm sure they took away, from your presentation some tips, some things they should be thinking about, and the remaining 20%, like they've got it on their roadmap. All right, and now on to our next presenter, Chad from Dispatch Health. The floor is yours.
Yeah, thanks, Mike, and nice job, Jamie. in all of the digital components that you presented, I am envious. So I'll talk to you a little bit about who we are. We are bringing the health to your home, transforming the facility-based care model. And so I'm going to give you a couple of highlights of Dispatch Health, and I'm really proud of the work that we've done. We'll launch our 31st market tomorrow in Chicago. When I joined the organization, there were 7 markets. And we had very little on our roadmap from a care or customer service standpoint. But we are delivering a number of healthcare that used to be in a facility to the home. And so you can imagine the pandemic certainly helped out in the acceleration, but the work that this team, specifically our 2 founders, had done and the growth has been phenomenal. We have seen about 100 to 200% year-over-year growth, and this the market expansion is up to 31 now after this slide was created. But we maintain a 95 Net Promoter Score, and so the work that we do in the home, whether it's an acute care visit, whether it's the hospital in the home work, whether it's Clinic Without Walls. We certainly continue to deliver high-quality healthcare in the home. Just a couple of highlights about kind of why we're continuing to invest and why we're continuing to grow. You think about there'll be 9 million seniors will be homebound by 2030, and we are absolutely equipped to go into facilities, into homes and places of people's residency, wherever that might be, to deliver a level of care. I wanted to just talk about the products that we deliver real fast. Clinic Without Walls is a virtual visit. Our acute care, which is the majority of our business, think about it as an ER substitution. Bridge care, hospital to home, so folks that have been in a surgical situation. Sorry about that. And then extended care, which is nursing facility substitution, and advanced care, which is our hospital room substitution. All of those products are delivered across many of our markets, or have expansion across many of our markets. And so I'll just leave this slide on for folks to look at, and I'll talk to you a little bit about our digital transformation over the last probably 2.5 years. So we came to the decision to bring on Genesis as our telephony partner back about 2.5 years ago. And the reason why was to create an omni-channel environment for our patients, for our clients, for caregivers. And with the Genesis cloud services afforded us the opportunity to begin to kind of build out that roadmap. We are probably about 30% of the way. Last year, we launched an intelligent IVR that afforded us the opportunity to see about an 18% call deflection on those calls that we were able to automate, to offer the chatbot for things like, our estimated time of arrival for the car, for the team that's coming to see folks. We mirrored all of the work that we have in our website, in our IVR. And so for folks who are able to utilize the IVR, utilize the web, they have the same information, whether that be hours of operation, insurance that we handle. On the acute care side, folks want to know, do we service certain symptoms or certain issues? And so we have all of that information built in to the intelligent IVR. Avtex was a phenomenal partner for us in that, simply because many of us had in our previous lives built out an IVR, but never really from scratch. And so that's really where we were at about a year and a half ago. I will tell you, as we go into 2022, we are thinking about IVR 2.0 because we've learned a lot. We've learned that there is our aging population has struggled with some of the voice recognition components. And so moving from one level of voice annotation to another that allows for different dialects and different words to be used is one of the things that's on the list, and that we learned was a frustration point. We also allowed ourselves to recognize repeat patients in that digital transformation. And so recognizing that a patient had been seen with us, getting them to the right spot the first time without being transferred around. So really trying to create that first call resolution. We then launched our chat tool off of our website, which was super beneficial. The thing that I would say that we haven't gotten all the way through is we're not able to onboard or to intake via the IVR or via the chat tool, simply because we're still in our, our child phase of our organization and our technology, and our risk stratification tool is very complex, and we have patient safety in mind all along the way in an admitting situation or an onboarding situation. So we're working with our tech partners to create more of that. We do, in fact, have a very robust online website and a mobile app, but still we're not able to onboard in those tools. And so if you're a mobile app user, many of us, right, we do most things on the mobile app. So you go on Dispatch Health and you have to then still talk to the call center because you have to get onboarded and go through our risk stratification process. And so we have some work to do in our journey to really take people to truly being that digital patient that we know they all have a heavy desire to be. We also launched our patient portal this year. So again, not having to call into the call center to get test results, to look at my bill, et cetera. And so really trying to answer all of the needs of the journey of the patient, and not having to pick up the phone and talk to someone, but truly using those tools that we created. On our roadmap, as we continue to think about that evolution, is to get touchless onboarding done, and we have a really amazing new tech leader that came from one of the rideshare companies that joined us about 5 months ago, and he's building out a pretty amazing team that's going to assist us in building a pretty fantastic marketplace that we're really excited about, and we want to have as much touchless as we can. So we started the journey. Genesis is our partner. We have the capability of really utilizing omnichannel in a really big way. But the piece in the middle that we've got to figure out and balance is patient safety, patient frustration, depending on the demographic, and affording folks the opportunity to really pick and choose. Do I want to talk to someone? Do I want to do it on the web? Do I want to do it on the app? Do I want to do it during the IVR to get a visit and to get reviewed and seen? So Mike?
Chad, that was fantastic. Thank you. And some great insight in addition to what Jamie had shared. And it's going to, no doubt you've got a different journey that your patients are on, but I love the innovative ideas as well. And that's going to take us into our next poll question for today. And this has to do with patient and member experience. Hopefully everybody can see the screen. Does your organization have an executive responsible for patient and member experience? You heard Chad talk about how important this was, talked about including even a new stakeholder that recently joined Dispatch Health, the importance of having somebody who owns this be a member of that, at the table and part of that discussion when building a digital front door strategy. So we'll just give everybody about 30 seconds to submit their answers. All right, we're getting an excellent turnout on the responses. About 10 more seconds. And I'm going to say to my fellow panelists, given the questions that are coming in today, this is a pretty engaged group, and certainly a group that's familiar with digital front door and strategy just based on the questions. I was going to guess that there would be a pretty significant number of folks who have an executive responsible for that the experience, that consumer, that member, that patient, which is good to see. For those who don't, we will continue to drive home the importance of that. I think Matt Malashevsky's even got just a few things that we've learned here at Avtex, not only in healthcare but outside of healthcare, that we want to bring to this conversation. And a few of you look like you're not sure whether there is a clear executive that owns the patient experience. So let's use that as an opportunity to transition over to Matt Malashevsky to take us through some of the keys to a successful digital front door. Matt.
Excellent. Thanks, Mike. And as Mike alluded to, right, what's a success look like for a digital front door? When we engage our customers and when we want to think about this, right, we have kind of a checklist we like to go through, which kind of highlights kind of critical components you need to think about. First of all, it's all around organizational alignment. You want to make sure everybody is on the same page. Everybody's aware of the different goals and objectives that you're trying to obtain. And just make sure from the executives to the people who are involved, everybody's on the same page on what you're trying to do. Along with that, whatever that digital interaction or that channel that you're going to be engaging them in, if it's for your patients or if it's the technology components in the back end with your employees, everything is optimized. It's easy to use. It's intuitive, right? So that patient or employee journey is really taking into account that it is a seamless, kind of frictionless solution for them to really leverage these technologies. On top of that, you need user adoption. So first off, it's about ease of use, but you also need to make sure if your patients are aware of the new technology that is out there. So you have to work with your marketing teams and make sure they're aware that this technology is out there for them to use. And then obviously it's about the ease of use of that solution to make sure that they're continually coming back for that and reinforcing the value they get from those technologies. Also, what type of data you're providing them. Data is really the engine for this. So you need to make sure you have pertinent, relevant information, which is useful for them, that you're communicating to them. Mobile apps are great, but you have to make sure that it's providing value and there's a clear kind of a solution which they're going to be solving the problem or scheduling a meeting or getting information that is really valuable to them. And lastly, packaging this all together. Everything needs to be kind of clear and transparent. So you're providing all the information about the services that you're offering, the coverages that they're going to be being covered by, then also the cost which they're going to be responsible for throughout the services you're providing. Looking at it next, we also need to think about what are the benefits that an organization gets out of working on a digital front door strategy, right? And obviously, it's about the patients. Your patients are going to have better experiences. And what this means is just like everybody else, if you go through an experience, you're going to have a higher tendency to come back to it. So you improve your acquisition. You have better engagements. You have more loyal patients or members who are going to want to come back and use your services if they need to. On the flip side, you have your employees. And just as my job is, the better tools I have, the better I am going to be at my job, right? So I'm going to be more productive. I'm going to be more efficient. And most importantly, I'm going to be satisfied and have purpose in what I do. Right now, as we're looking at the Great Resignation, everybody's thinking about retention. And giving your employees a good tool set to allow them to do their job appropriately is critical, right? And this is a huge value that we see our partners taking advantage of. Next, something that a lot of people don't consider is actually having benchmarks for a digital front door. Having the right KPIs in place, as Jamie showed with some of his NPS scores, it gives you something to shoot for, but then also measure yourself constantly above and beyond those scores, right? And also with that, it's always about getting better. And as Chad mentioned, it's about the new trends that are coming out. People are going to change their engagement models. So what a digital front door allows you to do is have that foundational knowledge to kind of take advantage of the new trends which are coming out. this is an evolving story, and it is constantly going to change. So you got to be looking at what's going to be ahead, the different demographics and what different types of tools that they're going to want to engage with, to really make sure that you can quickly implement those to have a successful ongoing solution. Lastly, you also can't forget to consider the financial impact that it's going to have on your organization, right? You're going to be improving efficiencies, reducing costs, and hopefully improving retention and acquisition, right? So this only can help to impact your bottom line. Also, what this does, because now you have a roadmap and actually user stories for how you're going to be engaged, you're going to have a consistent, frictionless healthcare experience. So if something is not working, you'll have the ability to understand exactly what your pain points are and the gaps and kind of the improvements that you have to make along your journey. And really what this comes out to be is improve your patient health outcomes, right? In the end, doing a digital front door strategy or implementations or leveraging the different technologies that are out there, it's about helping the patients and providing the best experiences. At Avtex, our mantra is fueling exceptional customer experiences, right? And just in the healthcare field, it's about putting the needs of the patient first. It's about really personalizing their interactions. So every single time they come to you, you're helping them better manage their healthcare. It's making it easier for them. In the end, our goal in being in the healthcare industry is providing our patients with the best experiences. So, with that, I really appreciate, everybody listening in. I'm going to turn it over to Mike to walk us through some questions and also to wrap it up.
Thank you, Matt. And I think our timing is perfect. We're about 40 minutes in and we're ready for some Q&A, but I really like how you pulled it all together. What we heard from Jamie and Chad and Matt, and one of the things I'd like to emphasize is that what Matt and I find at Avtex is we have the benefit of working in a number of industries, and healthcare is unique, but there's also some things that we can learn from other industries who've moved faster or gone before us. And this is a conversation that Chad and Jamie and ourselves frequently have. What can we learn from others? But at the end of the day, we're all in healthcare because we'd like to help improve the health of our patients, deliver better outcomes. And I'd just like to say thank you to all three of our wonderful presenters today for sharing their stories and insight. And no doubt for those who either attended live or watch this recording later, I think we can help. Hopefully we've shared some tips to help accelerate their own digital front door strategy. At this time, let's shift to the Q&A. And we've got some fantastic questions coming in, and I'm going to do my best. We may not have time to get to all of them, but I'm going to route a few of these. And the first one I'm going to send over to Chad. So Chad, one of the questions that came in is, how do I help sell my leadership team on the importance of a digital front door strategy? Sounds like this user's certainly on board, but wondering how do they best sell that internally?
Yeah, it's a great question. So I would tell you, I was able to have some initial conversations with our leadership team upon joining the company, really understanding what our pain points were, and then really kind of tying that into our 5-year plan or our 2-year plan or whatever, how many years you want to look at. And then I actually brought on a partner to come in and assess from kind of start to finish all of the places that we needed, service intervention, technology intervention, digital intervention, and that's what kind of drove our roadmap. Was a partner that was very familiar with the contact kind of consumer retail healthcare space. That presented to all of us after a very short engagement of here's what we would do if we were you, and that's what we've been working off of. It will continue to be refreshed and refound and et cetera, but it was kind of our North Star.
Great, thank you. Matt, Jamie, I don't know if there's anything you'd like to add to that.
No, I would agree. I mean, the data that you guys highlighted is part of what our process has been, is looking at third-party data. I think Chad's point on pain points and saying, here's how this strategy can resolve these pain points and help move the organization better, move the organization forward. I think when you bring that data to those pain points with a solution, that's what really helps get folks on board and get excited about it.
Excellent, thank you. The next question is, I think, Jamie, we'll start with you here, and it has to do with provider schedules. We hear this question quite a bit. We're interested in offering an automated self-schedule or giving our consumers the ability to schedule their own appointments, but how do you convince providers to sort of relinquish that control over their schedules and open it up so that you can enable those tools and solutions?
Full transparency, we have not figured this out at scale. It is a very difficult thing to do. What we've tried to do is balance, yes, it's a consumer demand, it's something they're looking for, but we have to make sure that we're delivering on a promise to protect the provider's schedule. So we're doing some data analysis right now to understand, what capacity looks like, how providers manage their schedules, and then setting some standards. And we're not going to go as far as we'd like to with schedule standardization, because I think we have to earn the right from providers right now to get them there. But the moral of the story is, what problems do they have as a provider? If you're talking about burnout, if you're talking about making sure that they're getting schedule matched, don't put a 40-minute appointment in a 20-minute slot. We're using tools to make sure that we're not violating the provider's schedule. So we do it in pilot phases, where we've done some pilot work with a PCP group to prove that, yes, we can standardize, present this online, and protect the schedule. So kind of making sure we're solving for both sides of the coin, both the consumer and the provider, and then using pilots to prove the concepts is what's helped us kind of open the door. That being said, this is a mountain that we're climbing right now with a large provider group, because we want to open up more access. We want to help them manage their schedules. They're compensated through RVUs. We want to fill that pipeline for them. So we're trying to match kind of both that business case from a provider perspective and the consumer thing. But it's through pilots and proof of concepts that we've been able to go as far as we have.
Yeah, that's good feedback, Jamie. And in our experience, our recommendation is to start simple. Don't go after the complicated specialty care where there's lots of internal rules and requirements about surgeries or some of the others. Start simple with maybe some basic primary care visits and then build from there. Would you agree with that recommendation?
Yeah, I would totally agree, because I think, and frankly, you got to look hard, because what might seem simple is not all the time. But I would agree with you. Kind of start small, pick an area where you have organizational appetite. So the providers are not like they're on board and you can work in it. But I totally agree with you. Start simple, proof of concept, get some data so that you can use that to tell the bigger story.
Excellent. All right, the next question is for for anybody on the panel, actually. And it says, the transformation of the call center, how are you making this happen? How much are you doing internally? How much are you leveraging outside partners and vendors? Looks like they're just looking for some recommendations on how their organization should think about that call center or contact center transformation. Chad, do you want to start?
Yeah.
And then Jamie?
Yeah, I can jump in, because I know there's a couple other questions around kind of our technology stack, so I can tie those together to give you an answer to the question. So this is a big undertaking for us. On the front end of it, we're using the Genesis system, and Avtex is helping us kind of move to a cloud-based format there so that we have consistent telephony across the call centers and can standardize on that model. On the back end of it, the core is built around Salesforce. So the CRM system and their health cloud, the implementation there is Mercury Healthcare. It was eVariants who became Healthgrades, who became Mercury over the course of this last year. We use Mercury's content management system for our website, and we've used their CRM system and are looking at expanding with the Engagement Center tool. But again, that CRM and the Engagement Center are all built on kind of some core Salesforce functionality. So from an implementation standpoint, Mercury is also an implementation partner. Avtex is an implementation partner. And then there is a pool of resources from inside the organization, from my team, from operations, from HIT that are assigned to this project. So it's got internal teams assigned to it, and then a couple of big external partners that are helping us move those big boulders up the mountain.
Thank you. Chad, anything you'd like to add?
No, I mentioned the Genesis as our cloud-based partner, Aptex to support, and we have our own dashboard or CRM that's tied to Athena and et cetera. So it's very similar to what Jamie's got going on.
Excellent. Well, I'm looking at the list, and we have dozens of questions coming in. We're not going to get to all of them, but I'm going to pick two more that seem to apply to or would be appropriate for anyone on the panel. The next question is about employees and the customer experience. We've talked a lot about the customer or the consumer being a patient or a member. How do the three of you see employees fitting into this, and are they an essential piece to the overall experience strategy?
So it's one of my favorite topics, because I think as a contact center leader or an experience leader, I get up every day and I think about the employee and I think about the patient or the caregiver or the partner. And so tying one of the things I love most is tying the mission down to that contact center agent or ambassador, and making sure that he or she, from recruiting to your quality program to your performance management program, it's all tied to the mission, which is to keep people at home and to see them safely. And so if everything that we're doing and decisions that we're making, whether that be technology or process or scripting or training, is tied to that mission, then they understand their role. We've had very little turnover in the contact center space at Dispatch Health. Between Colorado and Texas, we do have a BPO partner that we've engaged with in the last 18 months in the BPO space. The turnover is a little higher, but I think just tying it to the mission and having that directly in front of them in every single thing that they get to see and hear and read is the answer.
Yeah, let me weigh in on that as well, Mike. I think it's important from the consulting perspective that we lead. It's about both the patient and employee. So our CX team weaves in both of those roadmaps and journey maps to really understand what the impact is going to have, because it's just not the touch points with the patients, but then also how the employees are going to be engaging them. If it's to a call center, or if it's to the CRM, or if it's developing other tools that they might have to leverage to, engage with them. So it's really about both from the strategy and how it's going to be used all the way to the implementation.
I'll just put a bow on that. At the end of the day, your employees are the experience. I think in the earlier slides, the last best experience is your competition. So, we can put great systems in place, we can put great processes in place, but that last experience that a patient has is with that call center agent, it's with that nurse, it's with that frontline person. And if we're going to deliver a great consumer experience, we need to deliver a great employee experience. Give them the tools, give them what they need to do their jobs. So I just think it's a critical part of the mix as you look at it, because at the end of the day, they are your brand. They're the ones that are delivering the experience. And you got to make sure that they have a voice, that they're involved, and what we're bringing helps make them more productive and more efficient so they can better serve the consumer.
I think those responses are fantastic, and I really appreciate it. I think that given the time check here, the last question that I'm going to answer, a number of you have asked if this recording will be available, and the answer is yes. We will make sure that everybody has access to that. For those questions that we did not get to, we'll do our best in a follow-up to make sure we reach out and can answer any questions. And so Jamie and Chad, we might be sending a few more your way to make sure that we can get back to those who attended. But I want to say thanks to all of you who've set aside time today to join our session on Digital Front Door, and the questions that you submitted and your participation in the survey results. One of the things we want to do is always leave you with some goodies at the end and make this valuable and insightful. And we've provided links to both our recent patient experience and patient sentiment survey. We pulled some data from it and included it earlier on. But also we've built a Digital Front Door interactive toolkit. And in there, you'll find scorecards to evaluate where your organization is at in terms of its maturity. We've built a presentation to help you sell the concept of a digital front door to your leadership team. I think that was one of the questions we answered earlier in this session, and many other helpful tools to help accelerate that path to a successful digital front door. Thank you again for attending. All of you continue to be on the front lines. Thank you for everything that you're doing in healthcare. Wish you well and continue to be safe. Thank you.
Well, that is all the time that we have left for today. I want to thank our speakers again for such an excellent presentation, and again to Avtex for sponsoring today's webinar. To learn more about the content presented today, please do check out the resources section on your webinar console, and we also ask that you fill out the post-webinar survey. Thanks again for joining us, and we hope you have a great afternoon.